Welcome back to our table talk. Today we're going to talk about how chiropractic is not an alternative to medicine. Now, think about this. Medicine does things really well. For example, if you have a fracture, okay, I'm still not going to the chiropractor. I'm still going to my doctor, okay? If you have a tumor, again, chiropractic, not the best thing to try and manage that. And then maybe you need something to be operated on. Those are the three main criteria for medicine. So, and obviously it has its time and place. But if you have, for example, anything outside of that, so you go into your doctor, for example, and a lot of people have, they don't have fracture, they don't have a tumor, they don't have anything to operate on. And what is the result of that usually? Well, they're going to prescribe you usually some kind of painkiller, and they're going to tell you possibly to go get some physical therapy, right? So you get some physical therapy, some painkillers, and the vast majority of people don't want painkillers. They actually want to get to the root of the problem and fix that. And PT may or may not work depending on if there's a nerve problem. Okay, so if it's not just a simple muscle problem, if there's a nerve problem involved, it isn't going to get better too. And I've had a lot of patients say, "Hey, PT didn't work," and all I have to say is, "Well, maybe it didn't work in the wrong order." Okay, it probably does work. It's just again, if the nerves are not connecting to the parts that need to be rehabilitated, obviously it's not going to get full connection, and you're going to be rehabilitating maybe the joint in basically not in the right place. Okay, so you have those three things. So if you don't match those three criteria, you probably get swept under the rug. You probably get some drugs, some PT. If it works great, if it doesn't, then what have you done? So the second most common reason to see, your medical doctor is for what chiropractors do every single day. We are the neuromusculoskeletal specialist. Okay, that's what we do. We take care of the nerves, we take care of the joints and the structures that support everything. So when it comes down to it, we are the guy that you probably ought to go to, but as the second most common reason, go see your medical doctor. So this is one thing that I would say it should be on the top of your priority list, is to be more on the preventative side of things. I have a lot of people that wait until it breaks down and then they come in here and they're like, really bent out of shape. And I would say that it's much better to be on the preventative side of things than wait till it breaks down. And it would be in your best interest, if you really care about trying to avoid drugs and surgeries and those kinds of things, to have a chiropractor, okay? Only about 7% of the population actually sees a chiropractor, and that number for me is way too low. We should have a lot more people that are more pro-health, proactive, and want to basically live life according to their terms. So keep watching us. We're going to keep giving more health tips. Take care, guys.